Hello everyone, uh, here from Tanzania. We are on the short course for Policy Advocacy on Genetics and Genomics. I'm Dr. Colin and my fellow Dr. Frank from Tanzania. We are in Group 6 and we are given a topic to discuss whether should national health system in Africa fund genetic testing for rare inherited disease despite their low prevalence. So come with me. By introduction, rare inherited disorder, also known as rare genetic disease, a condition caused by genetics mutation that are passed from parents to offsprings. And by epidemiology, this disease affects 3.5 to 5.9% of the total population, and that is the reason why they are called rare genetic disorders. Example of such diseases are Huntington disease, Tachy's disease, Duchenne muscular dystrophy disease, and as well we should understand sickle cell is not a rare genetic disease because of the distribution, epidemiology distribution and the number of people affected by the disease. So genetic testing is a rare disease that helps confirm clinical diagnosis and provide accurate genetic counseling for patient and therefore enables potential treatment option for the patients. Despite being despite its benefit, genetic testing is expensive, raising the question whether the national system should cover the cost. We as a negative team, we firmly believe that national system in Africa should focus on strengthening primary health care, improving the basic diagnostic services, and addressing the most urgent health needs for the huge population rather than focusing on a small group. So we acknowledge the importance of accurate diagnosis and medical advancement. We argue that prioritizing genetic testing for low prevalence disease is neither practical nor sustainable in the context of Africa's current health challenges. So limited resources should be directed toward more prevalent and impactful health issues to maximize the public health benefit for the majority. So we arranged our arguments in three key points, which follow as. So our first point was to competing health priorities in resources constrained system. So African health systems are already overburdened with high prevalence, infectious, and non-communicable disease. These conditions account for majority of morbidity and mortality, with infectious disease and non-communicable disease account for 80% of African disease burden. This is according to WHO data. In contrast, rare inherited disorder affecting only a small fraction of the population that we have seen, 3 to 6%. And therefore, with limited healthcare budget, resources should be prioritized to intervene a larger number of people in the population rather than a small number to be more effective. So our second point was high cost and economic unsustainability. Genetic testing is costly, requiring advanced laboratory facilities and specialized personnel, long-term investment in equipment and training. Many African countries struggle to provide even basic diagnostic services, making genetic testing a low priority for limited healthcare budgets. Funding such tests would disproportionately consume that could be used to addressing other millions of affected patients. We also talked about lack of infrastructure. Okay, most of African countries lack infrastructure to conduct genetic testing in different hospital level, tertiary, secondary, and primary healthcare. Although most of these lack conducting this genetic testing. which are more costful than other diseases. So even testing, if it's available, misinterpretation of the results in different hospital levels, lack of follow-up due to uh, misinterpretation, and could lead to ethical and clinical dilemma. As well, without well-developed genetic healthcare system, funding genetic testing alone would be incomplete and ineffective solution. As well, we talked about ethical and social concern. Genetic discrimination. Individuals with genetic disorder could face discrimination in employment, insurance, and as well marriages. Psychological burden after being diagnosed due to misinterpretation, and which needs more genetic counseling for uh, someone to understand what it means. For example, to understand if patient is a carrier. So learning about genetic condition with no available cure may cause distress of individual, the families. Most of the genetic disorders are not curable as for current uh, development and technology. There's a little public demand for genetic testing compared to the pressing health needs, making it ineffective use of the low resources. Fifth point, limited treatment options previously. So most of the genetic disorders are not treated, not even in Africa, even in developed countries. Yeah, we find difficulties in treating some of the genetic disease. As well, our sixth point, limited strong data on the impact. There's a lack of enough data that suggests that widespread genetic testing for rare disease would significantly improve overall health outcomes in Africa, whereas proving interventions like vaccination, sanitation, nutritional, maternal health programs have well documented success. So there is a lack of data to prove that it's important to fund for rare genetic disorders. Our last point is alternative approach are more practical. So instead of prioritizing genetic testing for rare disorders, African governments should focus on preventive healthcare and strengthening primary healthcare system. Investing in broad-based screening programs for highly burdened disease would benefit a large proportion of population. Expanding basic diagnostic services for infectious and non-communicable disease would save more lives in overall health outcomes. So those are points that we constructive argument. So we'll go on to a rebuttal point. So on access to healthcare is fundamental for human rights. Well, we all know that all human rights in all humans have a bond with the fundamental right to being to access the healthcare. So due to resources being limited, such as funding healthcare profession and medical infrastructure, it becomes necessary to allocate resources in a way that benefits the majority of the population. As well, prioritizing common and life-threatening health issues in limited resources is more realistic and effective to focus on a large number on people affected than those have significant impact. Medical and scientific justification. Most of the rare genetic disorders have no treatment options or very expensive, as we have seen. For example, the diseases that are rare or difficult in treating as Huntington disease, Duchenne muscular dystrophy, and such disease. So we insist that sickle cell is not a rare disease. That should be kept in mind. Economic and cost effectiveness. To be more cost effective is to use the available limited resources to utilize in a way that benefit the majority than to allocate to few or few number of patients that have been affected with the disease or with less impact. Treating genetic disease requires enough funding than treating infectious disease or malnutrition. So meaning that the same amount of money that could be used treating one patient with genetic disease could treat larger number of patients that with infectious disease or malnutrition. So we also visibility and implementation. there's a lack of enough data that suggests that genetic testing for rare disease would significantly improve overall health outcomes in Africa. That is direct, clear. So we came to the closing point where we firmly conclude that while genetic testing for rare inherited disorder is a valuable medical advancement, it is neither practical nor sustainable for African national healthcare system, given that given the continent's health care challenges such as infectious disease, maternal health crisis, inadequate medical infrastructure, and therefore resources should be allocated to interventions that provide the greatest benefit to the larger number of people. So thank you for that. So these are reference, and thank you very much.